Hello, everyone. Hope you all are doing good. My name is Ananya Pal, and on behalf of Tribeca Care, I welcome you all to this discussion on COVID-19 Omicron variant alert with Dr. Somnath Bhar. Dr. Bhar is MBBS, MRCP, and is associated with GD Hospital and Diabetes Institute, Kolkata. Welcome, Dr. Dhar. Hope you are doing good.
Thank you. Thank you for giving me this opportunity to speak something on Omicron variant. So thank you, Tribeca and others who are involved in this program. Thank you all.
So, Dr. Bhar, can you please tell us what is Omicron and why it is a variant of concern?
So Omicron is basically, you can say this is a mutant or a deviant of SARS-CoV-2 virus. So initially in the pandemic, when the pandemic was started in the year of 2020, particularly in India, in abroad it has started earlier. So in those time, there were different variants, and last time we came across a variant that is called Delta, and that Delta was mutated further to form the Delta plus virus. And maybe a couple of months ago, we came across this Delta plus variant. Particularly during the second wave, the Delta plus variant was very much predominant, particularly in India. But in this third wave, we are encountering a completely new strain that is called Omicron. So this is a antigenic shift. Technically speaking, this is an antigenic shift from Delta plus, and that's why the character of this virus is a bit different from Delta plus, and we are getting some different symptoms in this Omicron variant in this third wave only.
Okay. So, since we all know that Omicron's transmissibility is quite high as compared to the Delta variant, but with all the evidences we have right now, it is not causing that severe illness or compared to the Delta variant. So, my next question is, can you please explain what are the symptoms of Omicron and what are the isolation protocols?
Okay, so during Delta plus, we used to see the lung involvement much more, because we usually did some CT scan of thorax, and we got some CT severity score, and that is how much lung is involved, that has been expressed in CT severity score. So that may be 10, 12, 14, 16, 18, or maybe more. So higher the number, the score is given out of 25. So higher the number, more severe involvement of the lung. That we have seen in case of Delta. But in case of Omicron, the lung involvement is minimum. It is mainly involving, or it is mainly affecting the upper respiratory tract. Upper respiratory tract means nose, throat, and almost up to this. Lung, particularly lung, is not involved in Omicron variant. It is much more contagious. It is much more spreading. From one infected person, it can spread up to 5, 6, 10 or more people. So, but in case of Delta, we didn't see this. In the later half, particularly in the second wave, the infectivity or the potency of getting infected was very less in case of Delta. But this Omicron has got a severe potency to spread, and that's why in the third wave we have seen a sharp rise in the number of cases worldwide as well as in India. So, but this is less severe as it is not involving the lung parenchyma, and particularly this is confined into throat and nostrils. And to say something about other signs and symptoms, you can see that in case of Delta variant or in the earlier phase of our pandemic, we used to get a particular symptom, that is loss of smell. But in case of Omicron, the loss of smell is not that much present. We are not encountering that symptom, and the oxygen saturation drop was higher in case of Delta. But here we are getting almost normal oxygen saturation, or maybe some patient they are requiring some oxygen at a very low concentration. But running nose, that is more. in case of Omicron. And other symptoms are more or less similar. The cough part is there, the weakness, loss of appetite. In some cases, we are getting diarrhea also. But Omicron is particularly different in the sense that it is not involving the lung parenchyma much. In a very few patients, it is involving the lung parenchyma, and we are getting some involvement, like very little. Like the CT severity score is 2 out of 25 or 1 out of 25, like that. Not in case of Delta, where we are getting the CT severity score of 13, 14, 15 or more. So that's why it is different. And so far as isolation protocol is concerned, as Omicron is very much contagious, it is very rapidly spreading, we have to follow a very strict isolation protocol. Otherwise, everyone will be involved. Recently, the ICMR has given a guideline that 7 days you have to be isolated from the onset of symptoms or date of testing, and at least the last 3 days or 72 hours you have to be affable. That means no fever will come for the last 3 days, and 7 days from testing is over, then only you are allowed to go outside. Otherwise, you have to be in isolation.
Okay. So we should not go into the panic mode by the name Omicron, right? Okay.
Panic mode, I think, look, the thing is that one thing is called panic, another thing, we have to be cautious. We shouldn't be panic, but we have to be cautious, because still there are some people who are not being vaccinated, like the pediatric population, they are not being vaccinated, and we are getting milder course of the disease. That is definitely this the disease course is milder, but still we have to be very much cautious, because nobody wants an infection to come inside our body. So we have to be cautious, and as well as we shouldn't, and this may be, to some extent, this may be dangerous to people who are having comorbid condition. In our ICU right now, we are getting this sort of patients. The COVID ICU, that is, we are getting, like, some patient is having a cerebral hemorrhage, there is a brain hemorrhage, and incidentally we are getting that patient is COVID positive, and those patients are getting admitted in COVID ICU. So COVID per se is not doing the damage, but if there is any problem like brain hemorrhage, like stroke, like heart attack, that picture is getting complicated with this sort of COVID infection. So that is a very particular concern in our recent days. Like the person, elderly person, and the pediatric person, elderly person particularly those who are having some comorbid condition, they should be very much cautious, and people around them, they also should be very much cautious not to spread infection to them.
Right. So can you please guide us, like, how to protect ourselves from this Omicron?
The guideline remains the same: use of mask, use of mask, and use of mask. You have to use the mask, a good fitting mask. If N95 is not possible, N95 is possible for the healthcare workers, but it is not possible to get N95 or to buy a N95 because it is expensive for everyone. At least you wear a good quality mask which is tightly fitting to your chin and around your face. And if possible, you can use a double mask while going outside or while going to bazaar or some congested area. And particularly social distance, maintaining social distancing to some extent, it is important right now also. So, and use of mask, use of hand sanitizer, and the basic things, those, the warning or those protocols which were given at the beginning of the pandemic, they are still holds true right now also. You have to be very much cautious about, and you have to be very much particular while going outside, or using the mask, using the hand sanitizer, and to maintain the physical distance. And in crowded place, obviously, it is better to use a double mask. And next is get tests done. When you are showing some symptoms like running nose, like fever, and in case of suspicion, you go for the testing. There are mainly two kinds of, there are different types of testing, but there are mainly two types of testing. One is RT-PCR and another is rapid antigen test. So rapid antigen test and RT-PCR, you go for the testing. Don't delay, don't hesitate. It is not a social stigma. Everyone is taking it as a social stigma. Why? You are having running nose, you are having fever, go for testing. Get the diagnosis done and then consult one doctor. Get isolated in a room for 7 days, you will be cured. So these are the basic simple rule that you have to follow. And following these rules, I think you can avoid rapid transmission of this virus.
Mhm. Since India has achieved 150 crore vaccinations right now, so are these vaccines effective against Omicron?
Most probably no. I am not in a position to comment right now because there are many data which are about to come right now. But the main vaccine that we have been given, one is Covishield, another is Covaxin. So those Covishield and Covaxin, they were very much useful against the Delta and Delta plus variant. That has been proved. At least they can reduce the severity, they can reduce the hospital admission rate. But in case of Omicron, probably, most probably, they are not protected. So if you are vaccinated, still you have to follow the basic rules like social distancing, like using hand sanitizer, wearing a mask. These things you need to follow.
Okay. So another important question is, can I get reinfected if I already had COVID-19?
Yes, definitely. That depends on the antibody titer of your body. So suppose you have been infected with COVID-19 virus in 2020, and there were some antibody which was developed, protective antibody which was developed in our body. And by this time, by January 2022, it can come down. And again, we can be reinfected, particularly so with some new strain. So that is possible. Definitely, that is possible. We have seen patients who were repeatedly being infected with COVID-19. Second time, third time, we have seen patients.
Right. Yeah. Yes. Um, Doctor, can you please tell us like how Omicron is presenting in vulnerable populations such as senior citizens and those with multiple underlying conditions?
So that is definitely, that is a point of concern, because as I have told earlier, that this vulnerable population or the elderly person with comorbidity, the Omicron can be dangerous in the sense that it is difficult to it is very maybe due to some comorbid condition, they are already in some stress, like they are on some medicines, they are on some drugs, they are having some restricted lifestyle, and on the top of that, the Omicron strain or this COVID infection can cause a disbalance of everything, and it can give rise to some sort of problem. So I have told earlier that in ICU mainly we are seeing these sort of patients who have been admitted due to some comorbidity, due to some other infection like urine infection, like other sort of infection in the body, and incidentally they are getting positive with COVID. And it is a difficult challenge, it is a difficult task for us to treat these patients. So elderly population with comorbidity, they have to be much more cautious.
Yes, and the people around them also need to be cautious.
Yes, definitely. They are the, because mostly the elderly people, they are not going outside. Maybe they are restricted. Their lifestyle is very much restricted to one room, maybe the bedroom and washroom. Up to that they can move. But how they are getting infected? They are infected from the people who are coming to them from outside. So we
Mhm.
have to be very much cautious. While I'm going to visit an elderly person, I must wear a mask.
Mhm.
I must protect myself. So that protective environment we have to offer to these
Right,
elderly people. That is very important.
right. And even the pediatric population too.
Yes, definitely.
Yeah. And how to manage like COPD in COVID-19 and even the winter season.
COPD means chronic obstructive pulmonary disease. So, so the people who are suffering from COPD, it is it is the well-known fact that during winter season, the exacerbation of COPD cases occurs.
Mhm.
And in COPD patients, they have to look for particularly three things for exacerbation. Number one, that is the amount of sputum that is increased, the change in character of the sputum, number two, and third, increased shortness of breath. So, amount of sputum increased, change in character of the sputum, and increased shortness of breath. These three are the flag signs for exacerbation of COPD. First, if you notice a COPD patient notices this any one of these symptoms, they must contact a doctor first, and doctor will advise how to tackle it. And on the top of COPD, if they are getting infected with COVID-19, it will be a difficult challenge. I mean, it will be a difficult task for the physicians to treat because they are already their lung is damaged. A part of the lung at least is damaged, and on the top of that, there are some infection with Omicron. So, so they must consult a doctor. And usually the COPD patients, they are usually receive pneumonia vaccine as well as flu vaccine every year, and pneumonia vaccine once in a 5 year. So that vaccine they must receive. They must be in a protective environment. And if they see any of these symptoms I have told, they must consult a doctor. And domiciliary treatment might require use of oxygen, use of antibiotics, and other things, other supportive things. And that must be provided to them without any delay.
Sir, so at last, do you want to give any special instruction to our viewers?
Not instruction, but as a doctor, I have seen many patients who are during the first wave, during the second wave. I have seen young patients, I have seen elderly patients, and we have to face a tremendous challenge. That is a very tough task. It was a very tough task for us to treat them emotionally as well as physically. So right now the Omicron variant has come, and hopefully this is not very severe, just some sort of upper respiratory infection which is occurring in these patients. And but still we have to be very much cautious. We have to follow the usual pandemic rule, the usual guideline like wearing a mask and other things. And we have to be vaccinated, usually with the the person. Everyone should be vaccinated against the COVID virus, two shots. And elderlies, right now the elderlies are getting the third shot also. And though elderly population, particularly who are having the comorbidities, they must receive pneumonia vaccine, they must receive the annual flu shot along with these COVID vaccines. And any symptom like running nose, fever, anything, shortness of breath, cough, expectoration, they must consult one doctor as early as possible.
Thank you, Dr. Bhar, for enlightening us. That was a wonderful session. As Dr. Bhar said, we should not panic by the name Omicron. But yes, we should be alert, follow the COVID protocols, and yes, get ourselves vaccinated. If you have any questions, remember, we are just a call away. Thank you once again from Team Tribeca. Stay safe and stay healthy.
Thank you. Thank you.